Hello, my name is Vanessa and today I'll be talking about vertigo. So, what is vertigo? Vertigo is a feeling of dizziness, feeling as if the room is spinning, or having imbalance and might lead you to falling over. During one of these episodes, you can also have involuntary eye movements, having a temporal loss of hearing. Symptoms can also include having nausea, vomiting, sweating, and having a pale complexion. There are many types of vertigo, and they're often symptoms of other illnesses and diseases. Thus, there needs to be an effective way to diagnose these. Vertigo is caused by damage or disruption in the inner ear. So, this is how a normal ear functions and how sound travels and balance is maintained. So, sound travels through the ear as air particles through the outer ear into the inner ear, and as it hits the tympanic membrane, which is the eardrums, it creates mechanical waves, which then pass through the ear ossicles, which is the malleus incus and stapes. And as it travels there, it hits the oval window, which then turns this into pressure waves in the cochlea. The cochlea is a as you can see, is a snail-like contraption with fluid, and it stimulates, it then causes pressure waves, which then stimulate the organ of Corti, which is contains cilia hairs. These hairs then turn into electrochemical signals, which then is transferred into the occipital part of the brain via the eighth nerve, which is also called the vestibulocochlear. So this is that's the normal ear. So this is how vertigo can cause disruption in the inner ear. These are three illnesses and diseases. The first one being benign proximal positional vertigo, which occurs when calcium particles in the vestibular get dislodged and travel into the semicircular ear canal, which then displaces the fluid. They can't move properly, so it disrupts your balance, feeling sense of dizziness and nausea, the normal symptoms of vertigo. This, however, doesn't cause any hearing losses at all. Labyrinthitis, however, does cause hearing loss, as this is caused by the membranous labyrinth being inflamed and is caused by a viral infection. So the disruption in the semicircular ear canals and the vestibular tubes disrupt your hearing, your balance and your balance. You feel dizzy and nausea, normal symptoms of vertigo. And as it also inflames your cochlea, hearing is also disrupted, and a mixture of hearing and balance is lost. In Mariner's disease, this is the most severe as it is incurable. This is caused by increased pressure in the membranous layer. So pressure is increased, the fluid is building up, and it affects the nerve endings and can eventually cause permanent ear damage. So how do we diagnose these? This is normally done by a medical professional like a doctor. Will ask you a barrage of questions to get to know what you're feeling. They can check for hearing losses, balance checks, and head positions that might trigger these vertigo. They can also do monitor your eye movements. As I've said before, one of the symptoms is involuntary eye movements during the episodes. So they can check for that and diagnose it. And they can also do MRI scans of the brain. So basically, diagnosis of vertigo is very wide range, it's very sparse. There's not a really particular way to diagnose these. And so to help with that, there are new studies by Australian researchers have explored the idea of goggles. And these goggles record eye movements in one of the episodes of vertigo and can ultimately distinguish these types. So this study is done with 117 volunteers, people who have these vertigo, and the results were that Mariner's disease and BPPV were the most effective in in detecting the type of vertigo. So Mariner's disease was found to have 95% sensitivity and 82% specificity, and it tracks the eye movements, the horizontal eye movements. So that's how Mariner's disease is detected. It's also detected by So BPPV is 100% sensitive and 78% specificity. So what are the benefits of this disease? The benefits of this disease is basically for more rapid diagnosis of it, and to make it more accurate, especially in reoccurring vertigos, and reoccurring vertigo that happens that might be just a normal vertigo episode like PPV, or a Mariner's disease, or it can also help in remote areas where there are limited resources and facilities, and so it can help administer treatment more faster and effectively, as well as in emergency rooms where it can help with faster diagnosis as well. However, there needs to be more research done into this new device, as Dr. Merriam from the University of Sydney, who conducted this experiment, says that there needs to be more variables and more research, more participants that need to be observed. So basically, the diagnosis of vertigo is very not specific, and not specific enough to detect it, and there needs to be a new way to detect it. Thus, these goggles are a step forward into treating vertigo. Thank you.